time, one of the most at-risk populations for the coronavirus are our senior citizens. In Seattle, at a nursing home that had an outbreak there, it led to nearly 37 deaths. So what are facilities doing to try and keep their patients safe? Joining us now to weigh in is former Kansas Governor Mark Parkinson. Governor Parkinson is also the president and CEO of the American Healthcare Association, which includes the National Center for Assisted Living. Mark, thanks for joining us. First, what is your biggest challenge? I know that these facilities have folks that are at risk as well as the staff there.
Yeah, this has been an unbelievable tough time for us. It really is the perfect storm because you have a really contagious virus that has an extremely high death rate for the elderly, as high as 20% for folks that are over 80 years old. And the very thing that we need to stop it, which are equipment, primarily masks, were made in the province in China where this whole thing started. So by the time it hit the United States, we didn't have the mask that we needed to keep it from spreading once it got into a facility or once it got into the general population. And so the results have been very bad. The number one thing that we've needed and continue to need is that we need more equipment and we need testing. I think the good news is that as horrible as the Kirkland outcome has been, every facility that gets COVID doesn't turn out that way. There are those that are out there that do have the equipment, they do have the testing, they do the right things in the buildings, and they've been able to contain it. But certainly the Kirkland incident and others across the country have just been horrific, and we're doing everything we can to keep more of those from happening.
It sounds like you're hopeful that things don't turn out like they did in Kirkland. So what steps are you taking and what kind of help are you getting to make sure that doesn't happen?
Well, it's been an enormous challenge because of the lack of equipment. But once we have the equipment that we need, we have the procedures already in assisted living buildings and in skilled nursing buildings to stop this. We have the infection control procedures that are out there that have a much better chance of stopping it than we don't have those things. And those are things like limiting the number of visitors. Young people, as we all know now, can have COVID and not realize that they're symptom-free. They have brought COVID into buildings and then it has spread. So we've really limited the number of visitors. We've tried to increase the testing so we know which employees do and don't have it. And then we've really tried to limit the number of employees that are involved with each resident. So instead of a resident having 20 people working with them in a day, they might have 2 or 3, which really limits the possibility of them getting the virus itself. But this has been the biggest challenge in the history of the sector, and we're still fighting away.
Okay. I hope that everything goes well. You get what you need, because I know how important that is. My father was in an assisted living facility, and it's such a, they depend on the people there so much, and you need the PPE to make that work. Thank you so much, Governor Parkinson. We appreciate you being with us. We'll have continuing coverage of the coronavirus outbreak after this.